If Tang Seng has hemorrhoids, you were his surgeon. Will you choose to live forever? Today we are going to chat that 59% of adults cannot escape. But I don't want to talk about hardcore topics. People and hemorrhoids. Do a soul torture first. Do you have any friends struggling in the bathroom for more than 10 minutes? Has anyone ever experienced the shocking red on the fingers after the poo? Or feel like there's a little meatball on the anus? It's uncomfortable to sit for a long time. Hemorrhoids, the venous plexus in the anorectum. It's like a little vascular pad. When he was under constant pressure, the result was chronic constipation, sedentary, pregnancy weight-bearing. These pressure assassins are targeting, become swollen and bruised. He started from a good cushion in obscurity, turned into hemorrhoids that brush the presence of the feet. Hemorrhoids can also be classified as internal or external. It grows in the anus. This is internal hemorrhoids. Typical symptoms are painless bloody stools, growing in the anal mouth. It is an external hemorrhoid that can be seen with the naked eye. Touch the little meatball, rubbing until it hurts. It's the existential type. Of course, there are also mixed hemorrhoids that should be closed inside and outside. The ultimate boss. That's the first step in defeating it. Our bodies are smart. If there is a problem, the signal will be sent as soon as possible. What are the distress signals for hemorrhoids? Blood in the first stool. This is the most common signal. Usually bright red blood. Drip or wipe on fingers. But please note, if the blood is dark red or mixed in the stool, be on high alert. This could be a sign of a more serious problem in the gut. It is necessary to seek medical attention in time. The second is anal swelling or prolapse. I just always feel like something is not cleaned, or there's a little meatball that comes out after defecation. Can go back by yourself in the early stage. Hand push may be required later. Even stay outside. The third is anal itching and pain, especially when external hemorrhoids attack. The feeling of sitting still. Presumably many people with hemorrhoids have a deep understanding. A recent national hemorrhoid survey found the incidence of anorectal diseases in our country is 59%. Hemorrhoids accounted for 87%. The incidence of hemorrhoids is 51%. Half of the general population suffers from hemorrhoids. This can easily lead to overcrowding in the anorectal department. If you say, traditional hemorrhoid treatment is like a radical pruning, what about today's technology? Has entered the era of precision and minimally invasive. Doctors and scientists around the world have released a lot of black technology. Microwave thermocoagulation technology. First in France and Germany. Mature applications in Italy and other countries. The doctor will use a special anoscope, an electrode that can only transmit microwave energy. Inserts directly into the hemorrhoid nucleus like precision guidance. Mainly focus on a point-to-point strike. Microwave energy causes molecules inside hemorrhoid tissue start dancing like crazy. Frictional heat generation. Instantly reach temperatures above 60 degrees Celsius. Rapid coagulation and atrophy of hemorrhoids. The whole process is minimally invasive. It can be done under local anesthesia in the outpatient clinic. After treatment, it can be done as needed. Postoperative pain is very mild. Patients usually resume their normal lives within a few days. Hailed as a lunchtime surgery. Radio frequency ablation. It has the same effect as microwave thermocondensation, but it's more like a master of precise temperature control. This technology originated from abroad. In recent years, it has also been launched in leading domestic hospitals. It also uses a probe directly to the hemorrhoids under the guidance of endoscopy. Dehydrates and coagulates tissue using radio frequency energy. The big advantage is that the thermal effect is concentrated around the tip. Minimal damage to surrounding healthy tissue. Especially suitable for the treatment of internal hemorrhoids and some external hemorrhoids. Postoperative patients generally respond to mild pain. Ultra minimally invasive needle technology. It is another leap in the field of minimally invasive. They use very fine needles that are only 0.8 millimeters in diameter. With the help of a high-definition visualization system, doctors can do it like targeted therapy. Precise treatment of diseased blood vessels with high-frequency electrocoagulation. After very little intraoperative bleeding, leaving only a tiny eye of a needle, the entire treatment process can be compressed to a minimum of 5-15 minutes. After treatment, you can leave the hospital after a short observation. Truly realize the follow-up. It is greatly convenient for modern people who are busy with work. Most hemorrhoids can be treated with lifestyle modifications, improvement, and prevention. The first is the food revolution. The core goal is to make the stool soft and smooth. 7 glasses of water a day. At the same time, vigorously increase the intake of dietary fiber. For example, eat more whole grains, vegetables, and fruits. And chili peppers are a lot of biju these hemorrhoid stimulants. Those with hemorrhoids should respect and distance amorosid. Secondly, toilet discipline. Get your phone out of the bathroom. Set a goal. Limit toilet time to 3-5 minutes. Quick fix. And here's the thing. Don't hold back if you want to defecate. But don't push too hard. Also try wet toilet paper. Unlock the joy of being treated tenderly by chrysanthemums. And finally, habit formation. Avoid sitting or standing for long periods of time. Get up and move for a few minutes every hour. Secretly teach everyone a chrysanthemum exercise to lift the anus. Please lift the anus and contract the anus while inhaling. Feel to lift it up gently. Hold for 5 seconds. Then relax. Simple and effective. You can practice anytime, anywhere. If the following occurs, please be brave enough to see a doctor. 1 conservative treatment is ineffective for 2 weeks. A lot of bleeding. Even anemia symptoms such as dizziness and fatigue. 3. Unable to recover after hemorrhoid prolapse. Severe pain. Don't be afraid to resist seeing a doctor. This disease is a small spectacle for them. Hemorrhoids only have one-way tickets. Pay attention to rigid demand to be happy without hemorrhoids.